There are 241 active cases of coronavirus in Victoria. That's 12 new cases since my update yesterday. 6 are linked to known outbreaks. 6 are under investigation by our public health team. I'm sad to say there are now 806 Victorians who've passed away because of this global pandemic. That is one more since yesterday, a male in his 80s, and that is linked to an aged care outbreak. We, of course, send our sympathies and condolences to that family. A total of 2,745,493 test results have been received since the beginning of the year. That is 11,994 test results since yesterday. Again, as we always do, thank you so much to that almost 12,000 Victorians who went and got tested the day before. It's so important. We've got to keep those numbers up, and we're deeply grateful to each and every one of those 12,000 people who went along and got tested. There are 32 healthcare workers who are active cases. We wish them well, and we thank them and their colleagues for all of their hard work. The rolling averages to October 3 are Metro 11.9, Regional Victoria 0.2, cases classified as unknown source, so mystery cases across that period 18 September to 1 October. There are 13 in Metro Melbourne, none in Regional Victoria. The Metro Regional split, there is one, in today's numbers, there is one new case in Mitchell Shire. The Chief Health Officer can speak about that in just a moment. And there are just 3 active cases in Regional Victoria, including that one. Aged care active cases, there are 91 aged care cases that are active in aged care settings. That number continues to fall. It's very good news given the vulnerability of so many residents in aged care. There's only one active case in disability facility settings. That remains a staff member. That is pleasing as well for the same reason. And that is about all I needed to provide in terms of numbers of the day, other than to say today the weather is warm. It's not quite the day that yesterday was, and we would hope not to see quite the behaviour we saw Friday night, and in some instances a little bit yesterday. We've just got to stay the course on this. We're so close. Let's not any of us do anything that might undermine the very positive numbers, the very strong performance we've seen in recent days. The trend is with us. The numbers are coming down. Once we get them low, we can keep them low and we can open up again. And if you want to spend summer at the beach, then that'll be the time to do that. If we don't do anything silly, anything selfish right now. I want to thank all those Victorians who were going to the beach and did so in full accordance with the rules. All of those Victorians who went to the park, who followed the rules and were able to connect with others, were able to get some sunshine and some fresh air. Heavens knows Victorians have earned it, but it's got to be done in the right way. I think everybody gets that when they really take a moment to think about it. Let's not any of us do anything to jeopardise where we find ourselves. It's delicately poised, but we are there, ready. If we continue these numbers, continue this trend, we are ready to take that step, all things being equal, in just a couple of weeks' time. It's not too much for all of us just to see this thing through. That's the only option we have. If we try and shortcut this thing, then we'll be back where we were weeks and months ago. And it's a bit over 6 weeks ago that I wasn't standing up here reporting 12 cases. We're reporting 725 cases. You look around the world, look at Europe at the moment, and you see second waves are upon them or very close to it. This thing gets away very quickly. We want to avoid that, and that means everybody has to play their part. And I'm deeply grateful and very proud of all of those Victorians who are doing that, and that is the vast majority. We do focus on some of the poorer behaviour from time to time, and that's appropriate to a certain extent, but I wouldn't want a focus on that to take away from the amazing job that the vast majority of Victorians are doing. We are pleased to see these numbers trending the way that they are. We're on track with that adjusted timeline, about a week ahead of schedule, as we had indicated last weekend, and we've just all got to see this through. That's the most important thing. No one should be doing anything that potentially jeopardises everything that Victorians have given, everything that Victorians have fundamentally created, a set of circumstances that are so different to all of North America, large parts of Europe, large parts of Asia. we're in a very different position, and it's because of the hard work and the commitment and the absolute determination of Victorians to defeat this thing. Let's not any of us put that at risk. I'll now ask the Chief Health Officer to add to my comments, and then we're happy to take any questions you have.